a level of irritation that you could sense both from the president and his top advisors about why this had gotten as much attention as it did, perhaps not realizing when the president weighs in like this, it's going to get a great deal of attention. They went out of their way, Matt, to soften that language a little bit, to be a little bit more inclusive of the other side by the end of the day.
Well, but frustration also because of the timing of this. This comes up and gets all these headlines, even as the president is he's up to his neck trying to pass this health care reform. So clearly this is not what he wants people to be talking about at this stage.
Absolutely not, and certainly not at the top of the program as it's been this morning. And that's the difficulty for an administration that wants to control the message. They want to only talk about health care. The president's doing a lot of interviews. He's really out there. But, you know, if you think about the press conference the other night, it was a pretty dry affair. It was very clinical, talking about health care, and yet the only moment of some passion and some candor and some kind of personal interest was the president talking about his friend, Henry Louis Gates, Professor Gates. And so that is going to get attention. He's also very careful about the way he speaks about things normally, and this was a case where he went a little bit farther because he thought, as you could tell, that it was kind of a logical matter that this should have been a different response. The president, you can also tell, I think, is irritated about the ways of the press sometimes, and you could tell that he was genuinely surprised that this would rise to the top of the agenda in the way that it did.